Hi Jennifer, my name is Amber Thornton and I wanted to take a moment to respond to your discussion board post for discussion board number 3. And this week we've been discussing implementing mental health policy, and with the help of the World Health Organization giving us a mental health policy plan and program, we were, looking through the different barriers of what could prevent a policy from happening and being implemented. And so the barrier that you mentioned was insufficient resources, human resources, specifically trained mental health care, those trained in mental health care. And so the solution that was suggested that you mentioned in your post was use mental health professionals to train and support general health teams to prevent and treat most common mental health disorders, support consumer, family, and mutual aid groups, and work conjointly with traditional trained health workers. And so you also referenced the mental health officers that was mentioned in our text from Sri Lanka. Sorry, I lost it. There is medical officers of mental health. I was like, I'm saying it wrong. Was a great example that was set of how we can create new categories of work. I wanted to mention an article that I found, which was basically evaluating the effect of mental health training on the knowledge of common mental disorders. And that was one of the things you also mentioned in your post, was at the very beginning, is teaching traditional health works how to spot, how to recognize and diagnose common mental health disorders. And so this article was basically measuring the effect of mental health training on the knowledge of common mental disorders among medical officers, specifically in India. And I thought their findings were awesome. Basically, they assessed the knowledge of common mental disorders among 30 primary healthcare doctors before and after training using a multiple choice questionnaire. And the training sessions included didactic teaching and care-based discussions. And their conclusion found that the efficacy of the training program for primary health doctors improved the knowledge of common mental disorders. Basically giving them a proper attitude towards depression. And so it basically proved that the implications for the strategy itself of integrating mental health care into primary health care, it worked. That proper training can actually cause primary care doctors to feel more equipped, and this actually helps reduce overall the treatment gap that we find for common mental disorders, which studies have shown if we can catch them early on, it prevents them from escalating later on in life to more severe mental disorders. And so anyways, I felt like this was a great article. The author is Salazar et al. And their findings they proved significant improvements, not just improvement, but significant improvements were noted on the knowledge being increased. And so someone had mentioned in another post too that this could feel like a burden to primary care doctors who probably are already feeling overworked, especially in low income countries, to feel like they have to take on another task. But I feel like this article proves that if they're being trained well, that it can actually reduce a treatment gap and create more knowledge, reduce stigma, and create more awareness of common mental disorders that overall would increase the implementation of a mental health policy. So anyways, enjoy dialoguing with your posts, and talk to you soon.